Thank you, Dr. Bindu. Respected chairpersons, esteemed audience, and all the organizers. First of all, let me thank the organizers, especially Padma Kumar sir, for giving me this opportunity to present before you this topic. Actually, when I came, I was under the impression that there might be some gynecologists also who are present. But I think most of the audience are forensic, from forensic department, right? So maybe I am thinking that I am doing a job of taking coal to the Newcastle, because already you all know most of the facts and the intricacies of this law and this area. And most often, whenever there is a doubt regarding the any sexual any medical legal case, we call your department for clarifying our doubts. So that's what is happening, and there are some procedural and ethical complexities when we go for recovering and preserving the evidence, especially in the case of minors. So my topic today will be the giving you the practitioner perspective in child health sexual abuse cases. I will not go into the intricacies and depth on how to do it, because that is not, I think that's not needed. But most of the queries I'm putting forward, I would like to have an active interaction, because these are the queries either I had or I had called from my colleagues or queries from my colleague during the procedures. So we'll be going through the recommendations and practices regarding the collection and preserving evidence. We'll also look into the ethical dilemmas and ethical aspects, and briefly go through the importance of documentation, and in between we'll be putting in some scenarios. So the menace of sexual violence, as my previous speaker, the respected Judge Dinesh Pillai sir told, it is going up. The case reporting is also going up, and in 2025 till now, till date, till October, more than 4,000 cases have been registered, and we are steadily seeing an increasing number of POCSO cases. And the role of doctors is very crucial, and for this, I relied on these POCSO Act of 2012 and the Ministry of Health and Family Welfare Guidelines and Protocol, and taking into account the Justice Verma Commission reforms, and also the Kerala State Medical Legal Protocol 2019. So medical examination of a survivor will include an initial resuscitation, then taking an informed consent. Consent would be for both for examination, evidence collection, and also for police procedures. Detailed history taking, medical examination, age examination, and evidence collection as per protocol. Then documentation, packing, sealing, handing over the collected evidence to the police, treating injuries if any, testing and prophylactic measures, psychological support and counseling, and referral for further help. Among these 12, I will be dealing only with the procedural and also the collection of evidence. And most of the history taking, the psychological support, counseling will be dealt by Dr. Nitya, who will be dealing with the more of the practical aspects. So in nearly all these areas, there are queries and dilemmas if you look at it closely. So how does a survivor reach us? She can reach on her own for treatment of the effect of assault, or she can come with a police requisition after a police complaint, or she can come with a court directive. Sometimes assault may not at all be the presenting factor. She may come with some other non-specific symptom. You discover that she has been sexually assaulted. Then who can give the care? So that is the most important question which always comes. Can a private hospital give a primary care? All hospitals, whether they are public or private, are mandated to carry out medical examination of survivors, and there is no need. Should she come with a police request? No, there is no need to have a police requisition. Then, who should examine a POCSO survivor? Is it a lady medical? Can a male doctor examine? A lady medical officer should examine a girl child below 18 years. And whenever possible, it's not always mandatory that a female gynecologist should only do the examination, but whenever possible, it is preferable to have a female gynecologist, especially if it is a vaginal penetrative sexual assault brought within 96 hours of stated assault. And in case of medical emergency, irrespective of gender, anyone can treat the patient. And this, the absence or a lack of a female gynecologist should not be the reason to refer a patient or delay the evidence collection. That's what is stated. So, need it always be a gynecologist. So, actually, this is what the protocol says. So, whenever possible, it is undertaken by a gynecologist. If she's on duty, if she's not present, do not refer if there is a female doctor present. But the point is, she should have undergone training in the protocol. So, when should we give the training is one thing, because should all doctors be trained in the examination and procurement of evidence? And so, actually, this is something which is, I just quoted it. Every registered medical practitioner practicing modern medicine is bound to examine without any delay a survivor. Then, where should we examine and where should we collect the evidence from? So, it should be the privacy is the key word. Even in a limited setting, we should allow privacy, and it should be from a designated area apart from the general court. Even in, this is a small place, which this is not our hospital, this is a government GH, which has arranged a POCSO care area. So, there should be a place designated like this. So these are the requirements. These are all given in the state medical legal protocol. The hospital or the casualty or the area should have a copy of the guidelines protocol. All the facilities for the medical examination, collection, packing, sealing, and all the tubes for vaginal swabs, smears, pubic hair combings, the combs, clothes should be there. Cotton, glass slides, comb, then metallic seal. For affixing on a melted wax, everything should be there, should be present in the area. And equipments, then 4 sets of unused clothes in 3 sizes should be made available. Then, if possible, toluidine blue colposcope would slam for UV light examination. And also, it's preferable to have the contact number of the CWC and also the mail ID of the nearby police station. Then this is a printed format where you all know that done in A4 size triplicate, original in white, then duplicate in light red and also triplicate in light blue. Then importance of confidentiality. As our district judge, the judicial officer told, it should be kept confidential at every step. The girl should be kept in a separate room. Records handling should only be in a need to know basis. No discussions, no gossips, no revealing the identity of the survivor. Then, regarding the informed consent, this is where again some confusions always arise. The informed consent, whenever we get the consent, it should be like consent is for examining, for collection of evidence, and also for police procedures. And do not proceed without the informed documented consent. Then comes the scenarios. The child is brought without a police requisition. What to do? The child is brought without an FIR, wants medical examination and treatment, but the parent or the guardian do not want to inform the police. This we always get. Then child is brought with FIR, but the child is refusing the medical examination and treatment. What to do? Can someone? Child is brought. It's very straightforward, I think. Child is brought without a police requisition. Can we examine? Should we examine? Of course, yes. Child is brought without FIR, wants a medical examination and treatment, but the parent do not want to inform the police. We have to. Yes, we have to. Should we not inform the police? We should inform the police. Okay. The child is brought with FIR, but the child is refusing medical examination and treatment. What should we do? Child means less than 18 years. POCSO. Counsel. Then refusing medical examination. Anything else? So we cannot examine without consent. Okay. Informed refusal should be documented. And anything else? Should we give an MLC register form? So this is what always patient girl has come to us. Fill and then give it. Okay. Right. The child is brought without, so we are bound to provide treatment. Brought without FIR, we are bound to inform the police because it's a section 19. We are bound to inform. And actually, as Dinesh sir told, even if we suspect there is a possibility of abuse happening, we'll have to inform. So that is clear now. Then refusing medical, neither the court or police can force for an exam, but informed refusal should be documented and unrelated witness signature should be there. Because they are saying they are not willing, we are just writing, there should be an unrelated witness. Who will be an unrelated witness in our hospital? It can be a nursing assistant, it can be a staff nurse who's not at all, or it can be someone from the administrative, depending on the situation of your hospital. Then, who should give the consent? Again, the survivor is less than 18 years, POXO case, consent of parent or guardian is mandatory. Then, age above 18 years, unless that person is unable to give, not able to give a valid consent, like drunkenness, mental illness, intoxicants, you have to get the consent from the survivor. So, if the child is more, this is a query which I have often faced. Child is more than 12 years. Can she give a consent? X. General physical examination. You can give, but not for the procedures. Yes, sir. Yes. Okay. So, minimum age of survivor for giving a valid consent for medical examination, that is a IPC, but I think there is some controversy because these people, the judicial people are saying this, that doesn't exist anymore. I will have to go and check in the afternoon. So, actually we used to say after 12 years, the child can give consent for the medical treatments and all, but in POXO, the age of consent is 18 years. So, it's always like in our Kerala medical legal protocol, the special law will always prevail over the general law. So, we have to have the consent of the parent in a POXO case up to 18 years. So, if you don't get the consent of the parent, what can, it might amount to the doctor assaulting the patient. Okay. Then, parent has given consent, but the child refuses, fully understanding the nature and consequences of the procedure. What should we do? Parent has given consent, parent is consent, but child is not. But make sure the child fully understands the consequence. You explain to the child that what can we do? Less than 12 years, we can proceed. After 12 years, okay. The parent refuses, but the child wants examination. Just remove the parent and what to do now? CWC. So you have to, okay, very good. So parent has given consent, child refuses, you have to defer. Because if the child refuses, you cannot, but you have to document it, you have to get it signed, and you also have to have a witness sign it. Then parent refuses, then report it to CWC, and examination should be conducted after getting an order from the CWC, and CWC should ideally appoint a guardian or a person nominated. Informed refusal of the parent also should be documented, and that will actually be a corroborative, maybe some supportive evidence, because there might be a reason why the parent is refusing. Then the person, the child cannot, or the parent cannot write the consent because of illiteracy or some language barrier. Again, we have to write and add to the note that this was written and read over and have a left thumb impression, and there should be an independent witness again for this, and there should be, if possible, use translators or special educators. Then, is it needed to take a separate? So now you have examined the patient, taken an evidence. Now for police intimation, should you get another consent, collection and all separate consent forms? No, there is no need. Then who should be present during the exam? Ideally, a parent or any person whom the child trusts should be present throughout the exam. If such persons are not available, no one is with the child. So it's a duty of the hospital to provide a person who is trustworthy. It can be a female staff who is nominated by the hospital head. If she is brought by a teacher or a counselor, like last week I called up Dr. Unmesh regarding this case in Wayanad. One child was brought to the casualty. She is in a hostel in a very remote area. Her parents are not here, and she was brought by the school counselor with, to whom she had confided, and she immediately brought. So can we actually take the consent of this counselor? Yes, we have to, because the dictum of loco parentis may be applied in this case. So we took the evidence, and later by evening her parents also came. Then, can a police personnel, only the police, sometimes we had a situation where the WCPO, the women police officer, brought the child alone because the mother was sick and she was in the same hospital only, but she was in the medicine casualty. The police personnel came. Can the police, that WCPO give the consent? No. Can a police personnel be present during the examination? No. You cannot have a police personnel present during the examination. And the girl has come, she tells she is 17. Should we do an age determination for all? These are all questions which I think these are all questions which I had written down and I remembered, because these are all questions I think I have asked so many of my forensic colleagues, especially I have made life intolerable to Dr. Unmesh. I think എപ്പോഴും എൻ്റെ കോൾ വരുമ്പോൾ ഉന്മേഷിന് അറിയാം ഒരു ക്വസ്റ്റ്യൻ ആണ് ഇത്, എന്തെങ്കിലും ഇങ്ങനത്തെ ഒരു കുറുക്കുണ്ടാവും. So age determination, no, it is not absolutely needed to do medical examination. Only when in doubt or only when there is no reliable documentary proof. This is a Supreme Court judgment. Now, coming to history, I think I'm not going into the history in detail. Relevant medical and surgical history, sexual violence history should be taken in very detailed manner. Narration by the survivor is very important, and if it is narrated by the accompanying person, that should be recorded. Attempted or completed penetration, even a verbal threat, weapon use, other injuries, and post-assault activities like bathing, washing, clothes changes should be documented in the history. Then this is our record, that pages, history in own words, unbiased, and there should not be any unnecessary comments. So this is how we go through that paper. It is not necessary, this is something very important, it is not necessary to document her past sexual practices or history during medical legal examination, and that's not needed. Examination, again general physical examination, injury examination, and also local genital examination. And it's always said, do not perform a finger test to establish rape or a previous sexual activity. So many times, I think more than 3 or 4 or 5 times, people have called us and asked, so PV should not be done? No 2-finger test. So that means PV should be deferred? What is your opinion?
Minor lacerations.
Yeah.
Then probably such kind of tests should be maybe speculum examination.
Speculum is a bigger thing than a finger.
But if minor lacerations are there,
minor laceration can happen. Do you mean that minor laceration can happen or with PV or with sexual?
with the sexual incident itself.
So actually my question is not that. So there is something written that do not perform 2-finger PV should not be done. So if the patient has been sexually abused, should you do a PV or not?
Sexually abused.
Yeah.
No, but then
What is a routine case?
A routine sexual assault case that comes to you.
That means no vaginal penetration or with vaginal penetration. Then should you do a PV or not?
Not be done by a male.
No, actually we are talking about only female gynecologist. We are talking about only female gynecologist, only female. That is sorted.
Is there any reason to do?
That is what I am asking. Should you do or should you not do?
Scientifically, if there is a reason.
It's because they have written that proof 2-finger PV should not be done.
Just tenderness and
Yes, exactly. 2-finger PV is not done to prove a presence of previous sexual activity, the length of the vagina, the circumference of the vagina. But you have to do a per vaginal examination, either using a small speculum which is lubricated or a gentle PV, to know whether there is a vaginal laceration or injury. We are doing a PV to rule out a vaginal laceration. You are not doing a PV to prove that she is very sexually active. And 2-finger, you should not write 2-finger loose, the measurement of the vagina and all. If there is a laceration, you have to document it. How will you know vaginal laceration unless you do a PV? So this was when this print came in print, this was the most common question asked by gynecologists all over Kerala, I think. So PV, you should not do a PV to know whether the vagina is patulous, she's sexually active, the length of the vagina and all. But you can do a vaginal examination. You should not write two-finger PV. Maybe to make yourself very safe, we can write vaginal examination done gently using a speculum. No injuries noted. No mention about the length or breadth or patulousness of the vagina or presence or absence of a hymen, intact hymen. So that's what I got from discussion with many, because two-finger PV should not be done. That's what it is written in that page. But പക്ഷേ അതിന്റെ last sentences to know whether the vagina is regarding the previous sexual activity. So these are the gray areas. Even now, people have two opinions. I know there are people who have extreme opinions about this. Okay, so no visible injury. Can you rule out? There is no visible injury. Actually, in vagina, whatever lesion, gynecologists will know that injury is presenting later than 1 week. Even after 2 or 3 days, the injuries will heal. It's very difficult to know whether there is an injury or not. 3 days, it's over. Just looks like a just looks like a scar. So, micro injuries, especially, you can spray 1% toluidine blue. That blue color, if it is catching, that's a fresh injury. Then this is just the pages. Then local examination, these are all just theory. Then pubic hair combing, scalp hair. And whenever you comb and get a hair, ideally you should take the hair of the patient's scalp hair and pubic hair also for comparison. And that has to be separately labeled, separately packed and all. Then injuries should be marked in. And it is actually told that only 10 to 15% of these pages need to be actually filled, because only these injuries are rarely present. So describe the age of the injury, abrasions, contusions, bite marks. If there is any blood or other stains, take it out, foreign body. So this is something I don't need to present before this audience. And whatever material we have preserved, we have taken, we have to actually label it. And whenever there is blood sample for DNA, you have to keep it in EDTA. Dried blood in a sterile gauze. Products of conception in normal saline for estimation of drugs and alcohol, sodium fluoride. Then, child does not, another query, the child does not give a history of any genital contact. Ene thondi, ane pichi, മാത്രമല്ല അങ്ങനെയൊക്കെ പറയുന്നുള്ളൂ. Should the genital examination be done? Yes. Right. Actually, it is said child may not be able to fathom what has happened. That is what. So actually, in an adult, in sexually, when the patient comes as a survivor, if in the history she is coherent and she is of normal mental presence of mind, if she doesn't give you a history of a genital contact or penetrative sex, it is not needed. But when it's a child, examination should not be conducted except in a child survivor, from whom it may not be always be possible to get a complete history now. And after 10 days, the child says that the penetrative sex or genital something has happened, then we have lost that window of opportunity to collect the evidence. So in child, in POCSO, it's always better to take a genital swab and examine. Again, this is a sample collection kit, the SAFE kit, sexual assault forensic evidence kit. The relevant, all the material should be preserved according to the nature of the sexual assault. And if the survivor comes within 96 hours, that is 4 days, it's mandatory to take all this, but may prefer even after 96 hours, because within 1 week of the sexual assault. And there are anecdotal reports of getting spermatozoa even after 1 week, up to 13 days, 14 days. So it is better you take a swab. Then, and sometimes the patient may not be telling you the truth at present. She may be just hiding. It can happen, especially when it is an adult. I have got cases where this lady told the sexual intercourse happened 1 month back and vaginal swab, and she told there is no sexual activity after that, but we got spermatozoa, presence of spermatozoa. That is when asked further, previous day she had a sexual intercourse with another person. So it is actually better if the patient, whatever the patient tells you, we write it also. Then it may not be so confusing when the report comes. Then, so loose hair, intact scalp also collected. Then clothes should be air dried and folded so that the stained parts are not in contact. It should be preserved in a paper car and should be described and labeled. The blood sample again, something repetition, and anogenital evidence also. Then these are all the next pages, few pages. And then the reason for conclusion. I think in that whole book, that is the area which is most confusing. The reason for it based on history and examination and based on the reports of examination, you can see it as corroborative or not inconclusive and all. And whenever, and now the next thing is regarding the documentation. So documentation, ensure correct documentation. As sir told, when the case sheet or this paper comes and you're standing in the court, it is very difficult to explain yourself whether why you have striked off that thing or why you have written it something again, because during your writing it might be your natural habit to write something, cut and then write, but always remember to not overwrite, single strike and sign the corrections. Preferably single person. What happens in some places where there are too many people around to help you is the one postgraduate or one of your residents will start writing this, and then another doctor, the senior doctor, comes and completes it. So it's better it is a single person writing, preferably with the same pen also. Otherwise കോടതിയിലേക്ക് വക്കീൽ നിന്നിട്ട് ഇത് പിന്നെ എഴുതി ഉണ്ടാക്കിയതാന്നൊക്കെ പറഞ്ഞു കഴിഞ്ഞാൽ നമ്മൾക്ക് വേറെ ഒന്നും അപ്പോൾ അല്ലെങ്കിൽ വി ഹാവ് ടു ഐദർ അവിടെ ഡോക്യുമെന്റ് എൻ്റെ പേനയുടെ മഷി തീർന്നുകൊണ്ട് ഞാൻ അടുത്ത പേന എടുത്തു എന്ന് ആകെ ഇതിൻ്റെ സൈഡിൽ എഴുതി വെക്കേണ്ടി വരും. ഐ ഹാവ് റിട്ടൺ ഇറ്റ് ലൈക്ക് ദാറ്റ് ബിക്കോസ് ഒരു തവണ കോടതി പോയിട്ട് ഈ ചോദ്യം ഉത്തരം പറഞ്ഞതുകൊണ്ട് I have written that the pen ink was over and so writing with another pen. അവിടെ എഴുതി വെച്ച് സൈൻ ചെയ്ത് ടൈമും ഡേറ്റും ഇട്ട് വെച്ചു, എന്നിട്ട് ബാക്കി എഴുതി. കാരണം പേനയുടെ പശ കഴിഞ്ഞു, വേറെ എന്ത് ചെയ്യാൻ പറ്റും. Then handing over the sample, requisition letter, presence അത് നമ്മൾ DNA പ്രൊഫൈലിങ്ങിന് കൊടുക്കുമ്പോൾ, and remember to number it correctly, all samples listed properly. It should be signed by the examining doctor, sealed envelope, wax seal, signed by the investigating officer to whom it is handed over. And the most important thing is a chain of custody should be maintained, the logbook should be maintain all the records of handover. And I think I am sure forensic people will be more methodical about this chain of custody and logbook. But in many places, when I went to Wayanad last 2 weeks, I have been behind them to have a register kept for the POCSO, because there are too many POCSOs in GMC Wayanad, because it's very common. So actually it is written and it's kept as a file. So I have now started having a register. So to whom it was handed over to, the time of handing over, and all things should be there. And ideally the handing over again, it should be signed by a independent witness, who can be a staff in the in the department. Then treating of the injury, psychological support, test for STD, HIV, HBCG, test for pregnancy. And when the girl comes, azithromycin 1 gram stat or doxycycline plus metrogyl can be given. HIV prophylaxis should be given only if it is within 72 hours and also after assessing for the HIV risk. Emergency contraception, again, you can be given or gestal within 72 hours. Confidentiality is the most important keyword. Chain of custody to be maintained when handing over is the same thing. Should not disclose the identity of the survivor or the findings to anyone other than the investigating officer or the honorable court. All records related to the examination, treatment, everything should be kept under safe custody, maintaining absolute confidentiality. Now, someone asks you for these details in Right to Information Act. Is it exempt? POCSO informations are exempt from RTI, Right to Information Act. So you cannot give. Then how long to keep the sample, collected sample? Because in Thrissur Medical College, there is a locker with my name, many bottles and boxes of how many months to keep? 3 months, 3 years. There are 3 months. Actually, there are more. I think 16 years ഒക്കെ ആയിട്ടുള്ള PG, പണ്ടത്തെ 16 years മുമ്പ് വന്ന PGയുടെ ഒക്കെ കളക്ട് ചെയ്തൊക്കെ ഇരിക്കുന്നുണ്ട്. Because they get transferred, they finish, complete their course and go. It's there. Because some ഔട്ട് ഓഫ് കോർട്ട് സെറ്റിൽ ആയിട്ടുണ്ടാവും. സിമ്പിൾ കേസ് ആയിരിക്കും, നീഡഡ് പോലും ആയിരിക്കില്ല. പക്ഷേ വാട്ട് ഐ യൂഷ്വലി മേക്ക് ഷുവർ ഇസ്, എൻ്റെത് വന്നു കഴിഞ്ഞാൽ ഫോൺ നമ്പർ വാങ്ങിച്ചിട്ട് വിത്തിൻ 1 week I ask them to come and collect. അല്ലെങ്കിൽ പോലീസ് സ്റ്റേഷനിൽ ഒന്ന് വിളിച്ചിട്ട് നമ്മൾ കളക്ട് ചെയ്യിപ്പിക്കും. അതല്ലെങ്കിൽ അവിടെ ഇരുന്ന് പോകും. ആഫ്റ്റർ 3 months വി ക്യാൻ അല്ലേ. എന്നാൽ പിന്നെ ഒരു വലിയ അലമാര ഒഴിവാക്കാനുണ്ട് തൃശ്ശൂർ മെഡിക്കൽ കോളേജിൽ. കോഡിലുണ്ട് അല്ലേ. അപ്പോൾ പിന്നെ അത് മാറ്റാം. കുറേ എടുത്ത് വെച്ചിട്ടുണ്ട് അവിടെ. പഴയ റിട്ടയർ ചെയ്തവരുടെയൊക്കെ ഉണ്ട്. Okay, psychological support and referral. Psychological care should be an ongoing psychological care, legal support services and shelter services. Regarding the counseling, psychological support and referral, I think Dr. Nitya will be dealing with. So this is something which strike my mind. A child will never forget a sexual abuse. It will never be gone from their memory. So she will always need a psychological support one way or the other. So some more queries. The police wants to immediately, you have done the examination, immediately take the survivor after the collection. Magistrate will produce. But your treatment aspect is not completed. You have to have some testing also done. What should you do? Actually, you should not, actually, they cannot take unless the treatment, everything, whatever you have to do is to be completed. Must wait until the treatment and care is provided. Police brought an unaccompanied survivor. Can the accompanied should not be asked to sign. Giving opinion to the police. Usually, this is what always happens. Once your examination, everything is complete, whether the rape has occurred, whether the survivor is capable of sexual intercourse, ഇത്രയും ചെറിയ കുട്ടിക്ക് intercourse പറ്റുമോ, ഇതൊക്കെ കോമൺ ആയിട്ട് പോലീസുകാർ ചോദിക്കുന്ന ക്വസ്റ്റ്യൻ ആണ് നമ്മളോട്. വെദർ ദ പേഴ്സൺ ഇസ് കേപ്പബിൾ ഓഫ് ഹാവിങ് എ സെക്ഷൽ ഇന്റർകോഴ്സ്, ഇതെല്ലാം ചോദിക്കുന്നതാണ്. പക്ഷേ ഈ ഗൈഡ് ലൈൻസിൽ പറയുന്നത് must not entertain these questions from the police, like these questions. The only thing, the factual thing, അവിടെ ഇഞ്ചുറി ഉണ്ട്, അവിടെ ഇതുണ്ട്, ബാക്കി നമ്മൾ ടെസ്റ്റ് എടുത്തില്ല. These are the only things you have to communicate to the police. So basic knowledge of medical legal aspects are mandatory for each RMP. Each case may be unique, may have its own unique scenario. You have to follow the guidelines and maintain professionalism always. Ethical principles should be strictly followed, especially confidentiality, and help the child to heal. Do not further traumatize the child, because the child already because they don't get traumatized because they are hurt, they get traumatized because they are alone with the heart. The physical assault actually is an act of terrorism on the human body. Let us not make it worse for the child. So these are my references, as I told earlier. And now one more question. What is ഞാൻ ആദ്യത്തെ 2 സ്ലൈഡിൽ ഈ രണ്ടും ഉണ്ടായിരുന്നു. ഇതൊക്കെ എന്താണ്? ഇതെന്താ? ടീൽ റിബൺ. ടീൽ ഇസ് ആക്ച്വലി ഫോർ ഓങ്കോളജി, ക്യാൻസർ സെർവിക്സും കൂടി ഉണ്ട്. ഞങ്ങൾക്കത് ക്യാൻസർ സെർവിക്സിൻ്റെ ആണ്. ആൻഡ് വാട്ട് ഇസ് ദിസ്? ആർക്കെങ്കിലും പറയാമോ? So this is steel ribbon is a sign of support for this sexual assault survivor, and that is the tattoo which is commonly put on by sexual assault survivors coming out enna paraya. So they are bold enough to announce to the world that they are a survivor. I am a survivor. Adana tattoo mark. So thank you so much. I hope it was useful, because I think this would have been more useful to a crowd of gynecologists. So thank you so much for your patient listening and active interaction. Thank you.
Thank you, Resmy, for detailing about the consent and the importance of documentation. So according to your talk, so if the victim comes, the child comes to a private hospital or the private medical college like this, is it better to refer the patient? Or
You should not refer.
Okay.
Because it's mandatory first point, because there is a delay of some hours if the if the child has to go somewhere else. It's actually mandatory. I think forensic people will no. Do not refer. Cannot refer. Actually, most of the private hospitals, even corporate hospitals, are taking medical legal cases now because of this. And അത് തന്നെ പ്രൈവറ്റ് ഹോസ്പിറ്റൽസിൽ ഫ്രീ ട്രീറ്റ്മെന്റ് ആയിരിക്കണം പോക്സോ, ആൻഡ് മുകളിൽ ഫ്രീ ട്രീറ്റ്മെന്റിന് ഒരു സീല് വെക്കണം എന്നുണ്ട്. ഇറ്റ് ഹാസ് ടു ബി. ഇസ് ദർ എനി ചേഞ്ച്? നോ.
We are appreciating you.
Should not deny.
Yeah. Should be free of cost. അത് ഞാൻ എഴുതാൻ മറന്നുപോയതാ. Okay.
Thank you, madam.
Yes.
You have covered everything that a forensic person also has to know. And thank you so much for enlightening each and every aspect of the examination part.
Thank you.
And I'm opening the
Yeah.
stage for any questions.
ഒരു ഫോട്ടോ എടുക്കും മറന്നുപോയി ഫോട്ടോ എടുക്ക ആ യെസ് യെസ്
One thing is,
Just two suggestions. One thing is, before going for any refusal, in the case of any refusal of
Reason for
consent or
refusal.
something like that, do not straight away go to refusal. You have to consult the child
yeah.
as well as the parents
Regarding the
for
consequence.
regarding the need of the examination.
Okay.
And one more thing, in one of your slides, you have mentioned that you should not write about her previous other sexual.
Yes.
That's only for adults.
Adults.
Not for the child.
Child. Okay.
Only for adults. Adults
Okay.
have the freedom of having indulging in sex with others.
Yes.
So that should not be a cause
Okay,
for some, some impression regarding the survivor by the court.
Yes.
That's why you should not comment about her other sexual.
Sex.
practices.
Okay. Okay.
That's only for adults.
So that is actually something I read recently for this. But I was also under the impression, why is it like that? Because
That's
that
clearly written in Kerala.
Kerala.
And the third thing that regarding the sample collection and preservation, that's also explained in Kerala Medical Legal Code. Actually, the medical officer need to preserve the samples maximum for a period of 3 months.
3 months.
Ideally, in all medical legal cases, they should inform the investigating officer. It's the duty of the investigating officer to collect the samples within 2 weeks of
2
examination.
weeks.
And if the investigating officer does not turn out, you have to inform the investigating officer. And after informing him, you can discard the samples by the end of 3 months, but only after intimating him
Written.
in writing.
Written.
But in my opinion, it's better to keep the samples, especially in POXO and CHOW.
I think we have talked about this. We have discussed this also.
Can you
Please
take a
comment.
photo?
We usually talk about
All these medical legal, whatever.
Resmy, can we keep a photograph of the injuries?
Actually, I asked our judicial officer also. എടുക്കാൻ പാടില്ല എന്നാണ് പറഞ്ഞത് കാരണം അവരുടെ പ്രൈവസി വയലൻസ് ഓഫ് അവരുടെ പ്രൈവസി ബട്ട് ഈ പറഞ്ഞ പോലെ ഇഫ് യു ടേക്ക് എ പിക്ചർ വി ഫീൽ ദറ്റ് ഇറ്റ് ഇസ് സോ മീൻ it's so useful because more than writing, that picture will be more credible. And but how do you maintain, I mean, how do you ensure that this is kept confidential, not accessed by any other person and all? Maybe in some years, maybe these electronic use of electronic, I mean, photos and videos of examination, we don't know, it might come into the armamentarium. Okay, if there are no other queries.
Thank you, ma'am, for delivering such an informative and engaging session. We truly appreciate your time and expertise. As a token of gratitude, we present a small gesture in recognition of your valuable contribution to today's event. So I request Dr.